Hey everyone, you're watching a sample that's coming from our Home Health Marketing Bootcamp. That's right, over 7 hours of amazing content that's going to be able to help you guys learn what steps you need to take in order to become that preferred provider. So just want to let you guys know, please make sure you stop by 10xpatientreferrals.com and sign up for this bootcamp. It is only available for a limited time at this moment. You might hear somebody say to you, you know what? They do a great job. There's no negativity they share, and they do a great job. You know, they're perfect. And one thing that I know is this: there's no such thing as perfection. Now, there's to be able to seek perfection is a great thing, but no one is ever perfect. So you can say something like, "Hey, that's so amazing. The fact that you're working with a perfect agency and you're doing great." Can I ask this question from a scale of 1 to 10, 1 being the average and 10 being the best? How perfect are they? Because sometimes all of a sudden you might get the answer, they're 8. Well then, guess what? They're not perfect because they're 8 out of 10. What would make them even more perfect and flawless? Now, you still got the answer you wanted. It's about how to ask the questions without being too aggressive. Of course, you have to be sure about yourself as well. You know, we'll even do something like this by not even making it a question. We would say something, assuming that we can get the right service for your loved one. This can work for a home care. Assuming we can get the right services for your loved one and the right care for them as well and deliver it at the cost that you're wanting. It's not going to break the bank. When would you want to start? Truth is, I need your okay here and here. Let's go ahead and start signing the paperwork so that we can start assessing your loved ones and we can start taking care of them now. Once again, it's an assumption clause. If you have all these different scripts in your arsenal, it's going to be able to really, really help you guys out. Another one is if somebody says, for example, I'll think about it. If somebody says, you know what, I'll think about it. Hey, look, I understand however you think about it. It will not change the fact that our services will take great care of your patients. It's going to reduce their readmission rates. It's going to be able to make sure that you're working with a reliable home health agency to work with you. Wouldn't you rather want to have that now than later on? Let's get it done. If there's anything else that need to be explained to you, what would that be? And so you can stack those. And then eventually you can even stack it with a 1 to 10 clause. By you ending that, that I understand to think about it rebuttal, you can say something like, on a scale of 1 to 10, how confident, or you can say a scale of 1 to 10, how great did I actually do the presentation, and maybe I missed something. What I need to do is I need to start finding out. This is where you really need to push. A lot of us, this is really honestly the sales part, the closing. The difference between average marketers and amazing marketers is that they know how to close. That they're willing to be uncomfortable. And most of us don't like selling. That's why a lot of us are not willing to close. That's why some of us will do the presentation and run, and hopefully that we have this feeling that we did such a great job that all of a sudden they're going to start referring to us, when that is completely far from the truth at all. And so we need to understand that that is possible, right? You can even say something, for example, if somebody says, I'll think about it. Hey, great. Most people want to take time to think about it. But let me ask you this, right? Let me ask you this. Thought is instantaneous. So if you were given time on a scale of 1 to 10, how absolute are you that you're going to want to work with us? Once again, I'm trying to find out. They say I'm absolute perfect. Now, I know you need to think about it. I know you're the decision maker. But here's the thing. How about I follow up with you? Would that be great? Can I come by or follow up in a phone call and visit you again next week? Sure. Great. Once again, you close for the next step. Once again, we're not trying to push. If there is resistance, you're not going to get the patient. So why push harder? But if you can get past these basic questions, then guess what? You're going to be able to win. Because you'd be surprised, you might get a referral right there and then. You might say, hey, out of all our services, which one of these services would be very beneficial for a patient that you have at this very moment? Is it, to educate the family member? Is it to provide the right medication reminder program? Is it to have the emergency button available? Is it to have the call light there for them 24/7? Is it the video call system that we can do with them? What can it do? What can you do? You want to start asking questions, because if they start mentioning these things that can be helpful, that's them making the decision that they like your services because they can repeat it. The only way you're going to know they know is if they can actually say it and they can actually repeat it without you telling them it over and over again. It's the same thing as you training your marketers in sales, in training. You need to practice, drill, and rehearse them. Can they say it? Once again, let's try this. What are those 2 questions? You guys see what we're doing in this whole training? I'm training you right now. I'm putting you in the spot. What are those 2 questions right now? Pause the video. Go ahead and tell me the questions. Verbatim. Go ahead. Say it. Pause the video. Okay, so you unpause the video now, right? What were those 2 questions? Right? The first 2 things to be able to qualify somebody. First one, hey, if you don't mind me asking, what are the 3 things that made you choose to work with those agencies in the past? Great, thank you so much for sharing that with me. Now, if there are 3 things that they can improve on to provide better care for your patients, but obviously at the same time take great care of you as a referral source, what would those be? Oh, they're perfect? Great. On a scale of 1 to 10 about perfection, 10 being the ultimate perfection, never makes a mistake, delivers everything correctly, just the definition of perfection. How would you rate them between 1 to 10 in perfection scale? Oh, they're an 8. Hey, perfect. What would make it a 10? Great. Thank you so much for sharing that with me. Actually, let me share with you guys a few things of how we are great at communication. You see, guys, how we start stacking things up here in the presentation and being confident, knowing what we're sharing? Somebody says, think about it again, right? If they say, let me think about it. You can use another script. What's another script? Hey, you know what? I appreciate the fact and thank you for the time and telling me that you want to think about it. But, we've done this long enough and I've spoken to a lot of referral sources, a lot of social workers. And, our goal here is to provide great care. Now, they're brought to you by our partners at homecareansweringservice.com and medicationreminderprogram.com. So medicationreminder.com, what they do is they can actually call your patients twice a day to remind them to take their medications. This lessens the chance of them being readmitted to the hospital. At the very same time, it provides value. It lets you show your referral sources that you are different, that you want to provide more services for your patients. It works amazingly for home care, especially with home health agencies. So look into this. It's a great thing for you to add for your company. They have 3 different plans, but later on we're going to share with you guys a way to be able to save even more. The next one, homecareansweringservice.com. Listen, at nighttime when you get a call from a patient or maybe even potential referral source on the weekends, sometimes you're not able to answer the call right away. At the very same time as you can save money, instead of hiring somebody to do your call answering, you can have homecareansweringservice.com handle this for you guys. At a low basic plan of $39 a month, they will handle your calls, especially in the weekends, especially at nighttime. You may have a manager in duty who's in charge of that phone, but at the very same time at nighttime, they may not be able to answer the phones for you. So sometimes when a patient calls at night, a family member, if you miss that call, they may end up in the hospital or you may lose that potential referral. Now, don't forget, we have our live marketing bootcamp events happening all over the United States, but we have now our online marketing bootcamp available, so make sure you take advantage of that. Go to 10xpatientreferrals.com and check them out. So these are some of the cities that we're holding a lot of our events. We rescheduled them because of the whole COVID scare. Please make sure that you pay attention. The dates may change at this very moment, but please check with us. Now, here is how you can save some time. So at 10xpatientreferrals.com, we have an online learning platform, teaches you everything about marketing. Okay, so we have 3 different packages. As you guys can see, if you guys choose the gold plan or the platinum plan, you're going to be able to get some free service from Home Care Answering Service as well as Medication Reminder Program. But if you just choose the silver plan, it's still great. You're still going to get 25% off the Medication Reminder Program or 25% off on the answering service. So please, 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 please let us know how we can actually help you. This is Michael with Home Health Success Academy. Always understand, marketing is easy when you know what you're doing.